My name is Mannion. I am the Senior Research Consultant in the Spine Unit of the Schultes Clinic, and I'm doing this interview for Spinal News International at Eurospine 2018 in Barcelona. The key findings from our study were that the factors that were associated with having an indication for surgery were more severe symptoms, more pain and disability, an increase in pain and disability in the last 3 months, so an increase in the symptom level, low psychological distress, severe spinal stenosis as measured on MRI, and a lesser degree of disc degeneration as measured on MRI. Typically we'll find that about somewhere between 65 to 75% of patients will have what we call a good outcome. So the operation has helped them or helped them a lot, or they've shown a clinically relevant change in our outcome scores. But actually this isn't an optimal level of outcomes, and this is what led us partly to look into the indications for surgery, because we feel if we could be more specific in finding just those patients who benefit most, then we would be able to improve the outcomes of the patients that we actually do end up operating on. The main message from our study would probably be that we need to look more carefully at the type of patients that we're operating, and we maybe need to try and develop some criteria to see in which cases is surgery appropriate and in which cases should we instead persevere with conservative treatment, so that we're trying to optimise the patients that we bring into surgery with a view to optimising their overall outcome. The study we carried out was a multi-centre prospective observational study. There were 8 hospitals involved, all based in Zürich in Switzerland, and basically we were recruiting patients who had lumbar central canal stenosis, and then it was just an observational study, so we had no intervention. They received the treatment that their own treating clinician thought was the best for them, and at the same time we carried out a thorough baseline assessment. We looked at every type of variable possible, so from demographic variables, psychological variables, clinical, neurological, imaging, to try and completely characterise the patients. And then we looked to see what were the features that distinguish between those that were referred for surgery and those that received conservative treatment. And it's this then that we hope to use to guide our future algorithms to be able to decide who is best suited for surgery and who not.